Recently, the high-profile suicide of a Missouri state official and his aide put the mental health discussion in headlines and everyday conversation, a topic often reserved for intimate conversations or no conversations at all. Tonight, we want to break down the stigma surrounding mental health issues and move this conversation forward. So stay tuned. And on Stay Tuned, you drive the discussion. We bring local experts, journalists, and civic leaders together to have tough conversations for a stronger St. Louis. Tweet us your insights on tonight's topic, and you've got a seat at the table. With a few national experts and a panel of community members, this is the show bringing more light and less heat to the issues that matter. So stay tuned. Thanks for joining us tonight. To help us get this conversation started, I'd like to welcome two guests to the table to begin with, and we'll do introductions first. Dr. Saeed Khajusta, Associate Network Director for Behavioral Medicine, SSM Healthcare, St. Joseph's Health Center, and also Dr. Anjan Bhattacharya, Division Director of Adult Psychiatry at St. Louis University. A lot of titles, but that also means you're well qualified for this discussion, so I appreciate you being here. Let's start broadly, if we could. What is the impact to the larger community when it comes to mental health? Maybe a better way of saying that is, why should I care if I myself am at home watching and don't currently have a mental health issue I'm dealing with?
I always say that mental health issues are things that don't discriminate. You can find it in the person in the highest office and any ordinary people who are walking on the street. It is part of everyday life of all of us Americans, and we have to deal with it one way or the other. Now, if we are dealing with that face-to-face, great, but majority of the time, as we all know, clinicians, it gets ignored or it gets untreated. But it is a reality of life every day, and in the light of a lot of issues that have been going on recently in St. Louis Metropolitan and in the nation, we'll see that mental health issues are coming to the forefront of health of the community altogether.
I would agree with Dr. Khajusta. I think nobody's immune to these kinds of problems, and the other thing is we may not think that the people around us or our loved ones are suffering, but many times these are things that people suffer in silence and don't talk about. So I think it's a good thing to be aware of and to be on the lookout for these problems, because you never know who's suffering with this.
I don't want to talk specifically about the high-profile suicides we saw, but I'm curious how you reacted to the larger community reaction or the media coverage of these very tragic two deaths. Was this like nails on the chalkboard to hear the way we kind of discuss mental health in our community currently, or did you see something positive coming out of these discussions?
I personally was shocked when I heard about it, obviously, because it was a high-profile one, but not because of being a high profile. You would assume that if someone in that position has had any mental health issues, one would come out and help. And that was a surprising thing to us, that nobody noted that, or if somebody noted the difficulty, it was not addressed properly. And that is usually, unfortunately, what we see with mental health issues.
Does that tell us how far we've got, how real this stigma is?
The stigma is very real, and I think certainly people in public life there's no way they can be honest about what they're going through, which is a real tragedy. I think, on the other hand, I think no matter what the nature of the discussion, the fact that it's on the table, we're discussing it, that's a good thing. Too often this gets ignored, it's under-addressed, underfunded, in both public and private endeavors. So I'm glad we're talking about it. It's a tragedy that it had to happen through the death of some very prominent people in our community.
Has it changed at all when you talk about it's not talked about, it's not funded? That's not breaking news. Has it gotten any better over the last 10, 20 years, or are we still putting these issues to the side?
I think we have made a lot of progress in the field of psychiatry and psychology over the last 30 years in the United States. Psychiatry and psychology in the United States are in the forefront of neuroscience. A lot of research, a lot of money goes to the research, a lot of academic institutions are paying attention to training clinicians. The problem is that either the resources are not enough or there's not enough funding from the state or federal government, and the need is growing. You see more and more people are being affected. The diagnosis is made at an earlier age of serious mental illness, and now we see a cohort effect, meaning that the nature of these illnesses are changing with time. You would not hear about something like autism probably 15 years ago very often. Now you hear that very often. We thought that it was 1 in 80 some people, 1 in 80 kids who were born in the United States would be affected. It's higher than that, definitely. So we're getting more data that supports the increased need for mental health in the United States and obviously all over the world.
And that's an excellent example there. I think the question that comes up is the diagnosis better or is the problem worse?
That's a difficult question.
It's not just specifically in that one area.
Right, no, more broadly, I think a lot of people ask the question. We're hearing more and more about depression, about autism, ADHD, many diagnoses. And I think it's a combination of both things. Some studies would suggest that there have been some increases in the prevalence, the occurrence of these illnesses. But I think also to a greater extent, we're talking about them, we're identifying people earlier, more often, and addressing it with treatment. So I think that's one of the positives, is that we are doing a much better job identifying and treating people that suffer from these illnesses. But I still think there's limits. I mean, we're in a time when everything in our society, our economy, is under pressure. And so funding is limited for many things. And unfortunately, this is a sector where people aren't able to advocate for themselves. There are wonderful organizations and institutions, universities that advocate for their needs, but it's still an area where it needs more attention, it needs more funding. There's a lot of people that need help.
Let me just ask a really dumb question before we go any farther. What is the range? What is the spectrum that we're talking about when we use terms like mental health? I mean, I think, for example, I'm surprised that all of a sudden we have autism in this conversation. That may not fit the stereotypical definition of this conversation. What's the spectrum that we're talking about?
I think this is often sort of misunderstood. I think mental health has a very broad definition. We're talking about relatively mild conditions such as phobias, people who fear heights and things like that, to severe conditions like schizophrenia, things that go from childhood, such as ADHD and autism, to dementia in the elderly. So there's a wide, anything that affects the way people think, the way they feel, the way they interact with the world around them, classifies as a mental illness.
I mean, every day we wake up with measuring our energy, physical energy and drive, but at the same time, you have to have some measure of emotional energy and health to be able to deal with your day-to-day activities, to be successful, to relate to other people, to function in your job, to be the person you are in your society. If one doesn't have it for whatever reason, depression, anxiety, phobia, marital discord, so on and so forth, then you're not going to be the person that you want to be in that society. And shows up, sooner or later it's going to show up in your functioning, the level of your well-being, and people will notice that you're not the same person anymore. So you cannot really separate mental health from so-called activities of daily living, basic things.
How do different communities interact with this conversation differently? Or perhaps the prevalence of mental health issues or access to treatment? How do different communities see this issue of mental health differently?
I think that that's a difficult subject, and I think it's something that we're beginning to study probably in the last decade to 2 decades. Their prevalences amongst some illnesses are very similar among. So for example, schizophrenia, to a great extent, no matter what community, what ethnic background, your prevalence is fairly similar. So there are some things that are cross-cutting in terms of how often they happen. But I agree that communities differ in how they react to it. I mean, some communities are more cohesive, they gather around and are more supportive. Other communities really have a hard time accepting a diagnosis or recognizing it, which then leads to not getting to treatment because no one wants to talk about it.
Stigma.
I think we have to be able to identify between the mental health and mental illness. Mental illness, unfortunately, has been stigmatized with the most severe illnesses such as schizophrenia, bipolar disorder, chemical dependency issues, while, as my colleague said, we do have a range of other conditions that are very common on a day-to-day basis amongst all of us: anxiety, depression, mild depression, that we have to deal with every day, and the prevalence is much higher. 1 in 4, 1 in 5 person in the United States will have some form of anxiety disorder in their lifetime. You have to deal with it. ADHD is fairly prevalent.
How does our insurance come into this factor into this conversation?
So in a number of ways. I mean, in years past, there was a huge disparity in how insurance funded mental health care, which has to a great extent improved, but still there are limits on the number of visits people can have, requirements for extra calls and authorizations for psychiatric treatments, which are often not there for basic medical treatments. So that's improving, but there's still a long way to go there.
The issue is that I think insurance companies mostly are doing a good job to make the service accessible and manage the cost, because if the cost gets out of control, we're not going to be able to have access. The resources, however, are limited. The fundings are limited for public health. The issue of the prevention of the psychotic issues, psychotic disorders, is a very important one. Unfortunately, traditionally, the clinicians have been sitting in their offices or in the hospital waiting for the patients to get sick and then see them and treat them and follow them over years. In mental health issues, by the time that you diagnose a serious schizophrenia or bipolar disorder, it may be too difficult really to change the course of the illness. If you can screen kids, same way that we screen them for vision, hearing problems, speech problem at an early age, we can screen them with rating scales by raters who have been trained, but they do not need necessarily to have years and years of mental health training, and continue to monitor them and find those who are at risk. We would be able to change the course of, number one, mental illness, number two, provide better mental health to our kids, number three, cut the cost ahead of time rather than waiting when this illness is so serious that it would cost the state, federal government, or insurance companies tens of thousands of dollars per year, aside from cost of the medication and, unfortunately, the disability that we see with those illnesses down the road, a burden on the community.
If I could follow up on that, I think one of the positives that's happened is for those people that do have private insurance through employers, there's been an improvement. Those insurance companies have realized they need to treat this, that there's a huge cost to society, to them as a company, if they don't treat depression and anxiety among people that are working. And so that's a positive. On the other hand, many people with severe mental illness, such as schizophrenia, bipolar, severe depression, to the point where they're not able to work. They're really impaired. And those people then those people rely on free care, state-funded care, Medicare and Medicaid. And of course, when there's limits on Medicaid and the whole controversy around Medicaid expansion, it disproportionately hurts people with severe mental illness that would otherwise qualify for things like Medicaid.
So a lot of talk about prevention in our physical health. Are you suggesting we need a yearly physical and annual mental health checkup?
I would say so. One of the models that under the new healthcare system has been proposed is to have and house a mental health professional in every primary care office to make sure that the doctors who are identifying mental health issues with their patients who come there for physical screening would be immediately referred to the mental health professional for care, so not only to treat the mental health issue, but also the impact of the mental health on the well-being and physical conditions, physical illness. You know that if a patient is depressed, they would not take care of their own diabetes or heart problem or congestive heart failure. These are commonly very costly illnesses in the United States. Cancer patients, all one way or the other, will suffer from depression or anxiety. You have to treat them to improve the quality of life. We will be facing a crisis with dementia, different types, of course. We hear about Alzheimer's very soon, by year 2025. And so we are not really prepared to deal with that issue. Not clinically, we don't have the infrastructure, and I don't think that finances and Medicare funding would be enough to deal with those issues. this comes to be a crisis sooner or later.
Gentlemen, we've just barely scratched the surface here. I appreciate you starting us off on the right track. We will bring you back in just a little bit, but in the meantime, we want to hear what you are saying about this, what questions you have. Find us with hashtag StayTunedSTL. Okay, let's talk about that stigma that we just barely touched on and maybe breaking down some of that stigma. Let me introduce our next guest, Teresa San Luis with NAMI. That would be, or NAMI. I always say it the wrong way. NAMI or NAMI?
NAMI, National Alliance on Mental Illness.
Thank you very much, National Alliance on Mental Illness. And Sonia Shin is also here. Let's just start, tell me how you got connected to you don't work with the organization, but tell me how you got into this circle.
I actually made a video last year about my personal story and what I had been through, and revealed that I had had a suicide attempt years ago, in the hopes of helping people, because there is so much stigma around anything mental health. Mm-hmm. And it's been amazing for me, just all the people that have come forth and started telling me things about, oh, I had this suicide attempt, or my child killed themselves, or just all these things that I think a lot of people, some of them hadn't even, they don't talk to anybody about, and some, I think they told me things for the first time ever. So it's been really just an amazing learning experience for me because I always thought that I was, like a freak or something was wrong with me, and I was very ashamed. And I realized that it's so prevalent, it's just that people don't talk about it. There's so much stigma around it. And then I was shocked to find that there's actually a suicide every 40 seconds someone somewhere in the world, according to the World Health Organization, kills themselves every 40 seconds. Wow. And it's amazing that this is so little, or people don't talk about it so much, because I think it's not like a heart attack or something where it's like an easy fix. So people tend to get into these crisis situations. And everybody, I think the numbers are a bit deceptive, because I don't think a lot of people even go forward and talk about something until they're maybe in a crisis or something like that. And everybody has something that, whether it's a chronic issue, or everybody has like a trauma that comes along. So maybe you lose a child, or you lose a parent, or your parents get divorced. And there's so many things that can set a person off, or it's just difficult. You get that distorted thinking, and it makes it difficult.
It sounds like you weren't expecting that response that you got.
No, not at all. I was amazed. All these people that, they were shocked that I had this situation, because I had accomplished so much. I mean, I've, produced for the Today Show and Nightly News, and I've been a TV reporter in San Francisco and Seattle, and here in St. Louis even. And I'd done so much, even, working for NASA, so everyone figured I was just this.
Had it figured out.
Yeah, I had it figured out, and it was, for me, it was a matter of, I was living in San Francisco and working in Silicon Valley, and I was there when the dot-com busted, and I got laid off over and over. And I pretty much, my identity was wrapped up in my work and my career, and I didn't have access to medical care anymore because I lost my insurance, and it was just, a really difficult situation, and I wasn't thinking clearly. Sometimes I was so depressed that, just getting out of bed, like just to wash dishes was like climbing a mountain, So, and I think a lot of people, as I've come out on my own story, so many people have told me, oh, yeah, I can completely relate. And so I think it's just, someone mentioned, like, should people have to disclose that they have like a mental illness or something, so they're not in these risky professions or high pressure professions. And I think it's crazy because I think that to put people in a box and separate them would actually be contributing to
The stigma.
And
the
make people.
misinformation, the
Yeah.
misunderstanding. Is this sounding at all familiar in the stories you've heard, or any personal connection to what you're hearing?
Oh yes, definitely. I experienced symptoms as early as preschool, but I don't think anyone, when they're a young child, tells themselves, when I grow up, I want to see a psychiatrist and be diagnosed with mental illness. So when I was a sophomore at Notre Dame, I was diagnosed with schizoaffective thought disorder, which has components of schizophrenia and bipolar disorders. But fortunately, my disorder is very manageable with the help of medication and psychotherapy. But back then, since I'd suffered off and on mental anguish and forms of neurosis or obsessive compulsive disorder or and psychosis even, where it was difficult for me to function socially and even in school. I have no idea how I got into college the way I did. However,
More people can relate to that than you might think.
yeah. But certainly in college is when people go away is when diagnoses definitely surface. And I was trying to function as hard as I could, but there was like a boa constrictor that I was walking around with in a sort of way, because I could not look people in the eye. I was very frightened by people's judgments. Different personalities were coming over me, and I was paranoid. I thought people could read my mind. And as well, I had disjointed thoughts. I could not complete a single sentence in its basic form in front of people. And I felt like a complete helpless animal. And the psychiatrist at Notre Dame gave me the option to go to the hospital, which I stayed for 9 days. And it was the scariest point in my life, because only one person in the world could I trust, because something as a psychotic diagnosis is a very frightening thing to swallow. And I just was extremely afraid to tell other people because of the stigma related to it.
Yeah, absolutely. I didn't ever tell anybody. I had suffered from depression starting, I think when I was I have a journal entry of suicidal thoughts when I was 5. I had, kids that would verbally, bullying, and then also would hit me in school, and that went on for years. And I always thought, well, they're going to lock me up if I tell somebody that I have suicidal thoughts. So I just hid that, and I just pretended well, yeah, I was depressed. However, and that caused, I think I could have gotten, maybe I would have avoided a suicide attempt had I been able, I felt more comfortable, if I understood, and I'd seen therapists for years. So for me to not understand that, and actually I'd been a medical reporter, so I figure if I don't get it, then there's a lot of people out there that are probably hiding things because there's so much stigma around any sort of mental illness or.
So how did you get to the point where you're talking about this publicly and sharing your story with other people, making the video you talked about?
Yeah, I just kind of got this crazy idea to make this video about my life. And I'd taken a personal development course, and part of the course was to talk about your story, and that everybody has a story. And do you want to live the story, the life that you're creating with that story? And I was like, you know what? And I looked at my life, and I was realizing I was telling a sad story, and I wanted to rewrite my story. So I made this video about looking at my life in a different way, and looking at my life not as a victim, as a victor, and having overcome great challenges. And for me, it was very healing, because I had a lot of shame around the suicide attempt, and then it was just amazing to me, because I felt very liberated whenever all these people came forward and started telling me that were either just supportive, or I was shocked by the number of people that came. And I've done spokesperson work, and I worked with this one makeup artist for the longest time, and she's like, I had no idea. I attempted to kill myself, and I would have never guessed it of you. And I was like, well, I certainly wouldn't have guessed it of you, And one of the producers I used to work with at NBC Network News, she told me that she doesn't even have a retirement account, because she figured she probably wouldn't live that long. Wow. So it's amazing the things that people are telling me. And these are people that are, very productive, like, so to say like people shouldn't have certain professions or, be considered disabled, like there's so much that people have managed to accomplish with these challenges. And yet, I think it's much harder on people because it's so difficult to talk about, and people don't know what to say about themselves, and people don't necessarily know how to respond. So I would love for there to be more dialogue, that people feel like they can share, because that connection is such an important thing. And then one thing I'd like to add is that, for me, I ended up getting help more in a behavioral way. So it wasn't so much focused on just throwing a drug at it or something, an antidepressant, because I found that really wasn't, because a lot of antidepressants have side effects of suicidal ideation. So I learned a lot of behaviors that were basically just coping skills. And I would love meditation, or go out for a walk, or do the opposite. If you feel like taking a nap and hiding from the rest of the world or retreating, get out, talk, make a call to somebody. And I would love to see children learn these things in school, just basic coping skills, because there's always going to be trauma coming in life. There's going to be something that's going to be difficult. And I realized, and then someone called me and they said, I've been killing myself with food for years. And I realized that all those addictions, like whether it's drinking or, overeating or smoking or something, they're just highly ineffective coping skills. And so I would love to see something where people are just learning some basic coping skills so that they don't have to necessarily get to a crisis or get into some sort of addiction.
Before we run out of time, I want to talk about In Your Own Voice. What's the In Your Own Voice program?
In Your Own Voice is a paid stipended speaking engagement with local communities such as universities, colleges, family-to-family classes held at churches, and so forth. I became involved in that in 2009, and you talk about your dark days, acceptance, treatment, coping skills, and then successes, hopes, and dreams. And so I joined this because I had been incredibly blessed with a wonderful recovery story. So many years of stability and support system and understanding by people. And the fact that I've been able to take what I've been blessed with in terms of intelligence or musical talent that might have helped me push through some of the mental health illness ailments to achieve some things that are higher than people might expect on a normal basis. I feel a calling to share my story and to give hope to other people that recovery is a real possibility with medication, proper psychotherapy, and having a great support team, realizing that yourself and your health are first and foremost, and that even spiritual Christian belief systems that have helped me, like it is better to give love than to receive love, or the Lord giveth and taketh. Letting go of some things that would otherwise cause a terrible, devastating amount of anxiety or distraughtness could help, along with all the other things that I just mentioned. So I just want to say that my mission and dream is to use my education, my resume, my grade point average, my accomplishments as a weapon to speak loudly about the message that you can overcome mental illness, and you can recover, and you can lead a life that is productive, far more productive, far less painful, with no more suffering than I've had for 2 decades of my life where I was not diagnosed. Mental anguish is not fun, but recovery and pursuing your dreams and being able to tell your story is fun.
Thank you for sharing that message. Thank you both for sharing your personal stories. We appreciate it very much. We have another personal story, a few personal stories that are interwoven together with some students at the University of Missouri. Our producer, Justin, spoke to them via Skype earlier in the week. Here's their story.
One of the problems on campus right now is the fact that it's almost like it takes, you have to lose someone to take the action, and it needs to become more proactive instead of reactive. We shouldn't have to have, lost 2 friends to make changes like this and to start the conversation. And it's shocking how little it's talked about, given the prevalence of suicide rates in this country, especially with college-age kids, 18 to 24. It's the second highest injury-related death in the entire country. And the fact that it's so stigmatized and so little talked about is just appalling, shocking.
After Ryan Candace passed away over the summer, we all collectively kind of came together and decided something needed to change. After Project Wake Up was started and founded, Julia Schroer came to us saying, there needs to be more. There needs to be more than just Project Wake Up. There needs to be a change here on our campus. So after she kind of came to us, we just took off with it and started something with that. Our name is already getting out there. Students are becoming familiar with MSPC, and people are starting to actually start that conversation.
And we're getting the privilege to do a lot of cool things. We're getting the chance to get training that faculty generally only gets, and so that's kind of giving us a little bit more legitimacy and kind of gives students an alternative outlet to go to.
What we've also seen with MSPC is we're trying to reach out to different groups on campus, especially the LGBTQ community, where suicide rates are very high within their own community. Before this, people were so scared or they just didn't want to say even the word suicide. That was a big deal to them. And people are now just saying that word. And then people also reaching out. So they're starting that conversation, but they're reaching out to friends and saying, I'm here for you. And that's a huge step. And it's okay to talk about this. It's not something scary.
They used to be social outcasts, but now I feel like now we want to bring them back, and we want to say, we want to help you. We want to bring you back. We want you, we want your old self back. And we're hoping that, through MSPC and the documentary, that we can finally make people aware of this and accommodating again.
After I lost Carolyn, didn't really deal with it in the best way. Kind of internalized my feelings about it, didn't talk about it, kind of, added to the stigma that surrounds it, honestly. And then when Ryan passed, enough's enough. We're going to try to make this tragedy positive here. Some people, Ryan possibly included, could have been helped if that stigma didn't exist, especially for college-age guys, college-age kids in general, but college-age guys especially. You got that tough macho aspect, and you don't want to be labeled as crazy or different. We all came together. It's myself, Danny, Morgan, and about 20 other Mizzou students and close friends of Ryan in St. Louis and in Columbia. We put together a 3-minute commercial, and then we launched a GoFundMe campaign with absolutely no idea how to make a documentary, with absolutely no idea how much money we needed to make one. So I set the goal at $10,000, and we hit that in 20 hours. It just shows the power of social media, and it also shows how important this topic is to people and how people want it to change. So with that money, we hired Nate Townsend, who is a St. Louisan. He is very talented, and he's very young. And I think that's where this film is going to be different than any other documentaries you've seen or not seen about suicide. Because it's made for college kids by college kids, and it's going to relate and it's going to hit home. And I think that college-age kids are going to want to watch this film. We have the emotional story that Ryan has. Ryan was such a driven, popular, determined guy with a bright future ahead of him. The last person you would expect or ever think of his own life. And Ryan's story embodies what I believe shows just perfectly that suicide does not discriminate. So with Ryan's story, with our passion, with our talented director and team, and we get some funding and we bring in some experts, there is no reason this documentary can't save many lives. My goal is to just take this documentary and put it on blast, put it everywhere I can, high schools, colleges, universities, mental health conventions, festivals, maybe Netflix, who knows? Anywhere we can. That's the whole point. We just want people to see it because it'll start the conversation and it'll touch people.
We're starting to change something. And so anyone can do it. You don't have to be this big name on campus, or you don't have to really step out and be someone who you aren't, but you can be yourself and make a change.
Okay, a totally different way of looking at this topic, I think, from our next two guests. First, I'll introduce them. Andrea Purnell, Artistic Director, Communications Director for University of Missouri St. Louis's Missouri Institute of Mental Health. Thank you for being here. Also, Mark Norwine, The Walking Man, which is, it kind of falls under the artistic realm as well. Tell me about Walking Man. Tell me about how that's changed the way you think about this subject.
Well, I had
Walking Man is a film, I should say.
It is a film.
Just to be clear.
It is a film. It's basically, it follows the walk across the state of Missouri, stopping at many of the rural schools. This was back in 2013, and I was going to do the walk for Chad's Coalition, and it just so happens my son had graduated from USC's film school a few months before, so he went with a crew and followed across the state of Missouri, stopping in rural counties and rural schools because of the fact that they have so few services.
So what did that walk teach you?
It taught me, first of all, that we were a tiny, tiny piece of the puzzle, and that it's such a big topic and such a big problem. And I'm concerned that we can't solve this problem within a generation like a lot of other problems, and it really needs to be because of the number of people that we lose every year to suicide.
Why? What did you learn that made you realize just how are things worse in the rural communities?
Oh, much. Yeah, the suicide rates. Suicide rates are 4 to 5 times higher than, say, St. Louis or Kansas City, and I would say partly because there is a certain type of person that likes to live, out in the country, out in the rural areas, and there's sort of an expectation that you'll be tough and that you'll get through on your own. So you have some of that. You also have a lot of schools that either can't afford or they don't have mental health services nearby, so they don't have people like MIM or Chad's Coalition or these other organizations coming in and talking about it, providing services for it.
Is the stigma greater?
I would say yes. Yeah, definitely. Greater in the rural areas.
How does art play a role in this conversation from your perspective? Tell me how your life experiences, your professional experiences, what is the lens that you see through here?
Sure. I think art plays a wonderful role in this problem that we're having. Just to back up, the Missouri Institute of Mental Health is an over 50-year-old organization. We have a science to service concept. We provide everything from research to evaluation to professional training. We even were part of the Walking Man film, which is fun. But they hired me a few years back from the arts community on purpose to kind of change things up a bit. I think out of the box, especially as it relates to mental health and mental health awareness, and we have done just that. 2 years ago, we produced a 200-person mental health flash mob in downtown St. Louis, and it was full of mental health consumers as well as advocates. A wonderful opportunity for the community to see mental health in a completely different light. We went on and have done many mental health art showcases. We actually have one happening next week at UMSL, and the idea is to use the art to do stigma busting, as we've been talking about in this evening. When you can see the art and see, wow, this is an amazing piece of work, and perhaps something that you would not necessarily think someone with a mental health challenge could produce, and you see it, it makes that person just that much more real. 1 in every 4 will deal with the mental health challenge within their lifetime. So it's happening in families and homes. And I think the arts allows us to talk about it without pointing a finger, as well as really just kind of expose, dispel myths. And we've used everything from, like I said, dance to theater to music. So it's a way, especially even as he's describing with the film, to use the art to spread the message, but maybe not so in your face.
What does it do for the participants? Is it empowering for them?
Oh, extremely, extremely empowering. I mean, it just, for many of them, it's a way that they can express themselves. Most oftentimes, if you have a mental health challenge and you don't feel like you can talk to someone, perhaps you can draw what it is that you're feeling and still get that, what I like to call maybe some of that out of you, in whatever capacity. So yeah, most definitely, it can really raise esteem levels quite a bit for those that are dealing with mental health challenges to work specifically with art therapists, which is very important for me to say. While I'm from the arts community, I'm smart enough to know when you're working with healing arts, you need to collaborate with the right people in order to truly get the message that you're trying to achieve, not only for the end user, the public audience, but also for the person with a mental health challenge that is overcoming because of the art.
This sounds like a pretty good example of something you would have access to living in the St. Louis metropolitan area that you don't have in maybe some of the communities you visited.
Well, not just that, but 75 of our counties out of 110, 115 counties don't even have a licensed psychiatrist in the county. And we are one of the lowest states in terms of child psychiatrists. We have less than 35 child psychiatrists in the state. We have kids that are waiting, that we service, that are waiting 3 months to get an appointment for a first-time appointment. And it's not because the psychiatrists aren't trying to get them in, it's because the psychiatrists are so overloaded. And that's sort of the state of affairs today.
Is it hard to get people to come to the program? Is it easy? Is there a waiting list, or you know, if you're describing a person who may be in a situation where they can't express themselves, I would imagine it would also be hard to show up for something like you're talking about too for the first time?
Sometimes and sometimes not. Just to give you an example, you were talking about culture just a bit earlier, and we've done some very targeted productions. One piece entitled Depression, Whose Disease Is It Anyway? A closer look at mental illness in the African American community. We had 150 audience members coming to presumably just to enjoy a show. But by the end of the performance, and I must admit, it's much more than entertainment, it's edutainment, if you will. So in between each vignette, we had a therapist come out and describe what it was that you were seeing, signs and symptoms. So it was like having a therapy session without the couch.
What was the response?
It was amazing. We had people stand up at the end, express their own challenges with family members, and then we had some that even made direct contact that day to want to seek therapy. And we had audience members stand up and say, "That's me. I saw myself in that person." And particularly for this community, this was full of African Americans, many of them expressed that they generally would not go to a therapist, you know. Unfortunately, it is still a very taboo subject, mental health in the African American community. What goes on in the home stays in the home, right? And so therefore, this was an opportunity for them to see themselves, feel exposed, but still safe, in a very, very safe environment. And it was a very positive response and able to connect with therapy right away. So we were very proud of that project.
I asked the first table what their reaction was to the community discourse around some very high profile tragic losses to suicide. What did the two of you see when you see just kind of the public discourse, the broadcast?
Well, we were actually at the Capitol the day before Tom Schweik died, and we were doing some testimony for mental health. Jill Shoup has a Bill 328 that she's trying to get passed into law, and we were doing testimony, and the next day we went home. The next day Tom dies by suicide. So we were blown away because we had just been up there, and I think in a lot of ways the legislators were blown away, and I think they really realized that really pointed to the fact that we have a real problem, and we have a problem not only with kids but with adults, and every adult was a kid at one time. So we can get this at a much younger age than what we're trying to get it at.
I have to point out something that he said, which just rung in my ear in such a beautiful way. He said died by suicide, notice, versus committed suicide. So what I'd like to point out is, especially as it relates to the communication circle, the education that can come to help not sensationalize a situation. What do you think of when you think of commit? Commit a crime, commit a sin, right? So when someone does die by suicide, their family is still left behind and they still have to live with that. So we can do a lot just in the communications realm to change the message simply by how we change our language. Another example is person-first language. Instead of saying, oh, that's a schizophrenic, or they have depression, you should say, this is a person that's living with depression or living with schizophrenia. So just those small little things can make a huge difference for how the rest of the community responds, reacts. The reality is that a person with a mental health challenge is a lot more likely to be a victim of a crime than they are to commit a crime. right? So just those facts, putting them out there will, I think, help bring balance, really bring balance to the situation before we do have a crisis, as was stated earlier.
You feel like that's a subtle, or maybe not so subtle, way of changing the conversation?
Oh, big time. Small but huge impact, simply in how the language is described.
And it's how that person then feels about themselves.
Sure.
Because when you say what, as you said earlier, that person then is such a negative connotation. Of course, they carry that, and they already have mental illness. They carry that further, and it.
So then it's probably wrong to ask, does a person beat mental illness? I feel like there might be a reaction to the question, the language of the question, and then maybe an answer.
Part of it is what mental illness. I mean, I think there are people that have episodic depression, and maybe they never have it again. I have bipolar disorder. That's with me for life. Our son has bipolar disorder. That's with him for life.
Yeah, and I think you know me well enough. I think you got it. Yeah, beat, as in you're defeating something that's wrong, that's negative, versus how do you cope with it? I think that's probably perhaps more safe language, because you're right. There are some mental health challenges that will live with you for the rest of your life, and you'll learn how to cope with them. You'll learn how to find different coping strategies that work for you, figure out what your triggers are, what you need to stay away from, those sorts of things. So there are ways to manage. And if it is not medication for you, maybe it's talk therapy, maybe it's exercise. So I also like to encourage people, if they have found something that did not work, try something else. Because there are a variety of different coping mechanisms out there for you.
What do you hope the film accomplishes?
Start conversation, just real simple. Just start conversations. We've handed that video to hundreds and maybe thousands of people that had somebody in their family that needed to see it because they wouldn't get help, and in many cases they got help. So I would say that's the number one focus.
Tell us where we can see it. Can we?
You can get it on iTunes. I think it's around $5 on iTunes. If you have AT&T UVerse, you can get it through that, and you can also get it through DirecTV. You can go to the website walkingmanmovie.com, and you can get a copy that way.
It's showing all over the place.
Yeah,
in California and everywhere. Great success.
Thanks.
And you're not just saying that because you're in it.
No.
Stick around. We're going to bring everybody back and continue this conversation. In the meantime, let's take another look at the hashtag #StayTunedSTL. Thank you both. So we like to continue the conversation online when we get done, and sometimes that's some of the most candid conversation we have. So we're tricking you, pretend like we're online. Still a family show, so watch your P's and Q's. But we're going to start our post show on the show, as we've been doing for the past few weeks. Something we've kind of touched on, but maybe I'll take it back to the gentleman who started our show off, and then we can branch out, whomever wants to jump in. Medication. Are we over-medicated? Are we under-medicated? There are people who probably may need medication that don't, and then others might argue that we throw medication at a problem and hope it goes away.
I think there are times that both are true. I think there are a lot of people out there that aren't seeking help, that do need treatment. And treatment can come in various shapes and sizes. I mean, there's medication, we refer to psychotherapy or talk therapy. And then for people with more severe illnesses, there are even things like devices. There's now vagal nerve stimulators, deep brain stimulators for people that have refractory illness that isn't getting better. So there's a wide variety of kinds of treatments. I think there are situations where we're over-treating people, and the challenge is for us as a specialty, as doctors, as a medical community, to try and hone it down and get the right people on the right treatments.
Fair?
I think as Dr. Bhattacharya mentioned, certain situations we are over-medicating. if we have dual diagnosis, usually a mental illness with a chemical dependency together, which happens quite often, 30–40%, sometimes up to 50% of our inpatients are those folks with dual diagnosis, so-called. They have a tendency for ask for more medication, and the clinicians sometimes tend to give more medication. On the other hand, I truly believe that some of our adolescents, especially when it comes to anxiety and depression, are under-medicated. There was a concern, obviously, with most of the antidepressants in adolescent population, and FDA had to put a black box with all of the antidepressants in that age group because there was a question about impulsivity and increased suicidal behavior. Now we recognize that that was jumping the gun. New reports indicate that it is not as high as we think it is. The only thing is that we have to dose these medications more properly. Now, there are two peaks for suicide when it comes to the age population. Age 12 to 19, and then 65 and above. If we are neglecting the treatment of that first group, 12 to 19, by under-medicating them with antidepressant, we're going to continue to see more suicides, suicide pacts, suicidal behavior, self-harm, and so on and so forth. Something that, as I mentioned, seems to be a cohort effect. We now see more of that. We didn't see that 20 years ago, self-mutilation happening to this extent that is becoming so common, unfortunately, amongst our child-adolescent population.
What do you mean when you say cohort effect?
As time goes on, the nature of some of the findings in psychotic disorders change. These days, you would not probably see those severe psychotic schizophrenics that we used to see them in state facilities, institutionalized for years and years. Medications have changed the course of symptoms even, or the nature of the intensity of the psychotic disorders. That would be a cohort effect. On the other hand, now you see more anxiety disorders, more impulsive behavior. Now you have the social media aspect and its impact on the mental health of our teenagers, something that we're facing for the first time. We don't know what the impact would be. All these electronics, we have kids, we have seen that, how we have to deal with those things as parents, but at the same time, as mental health clinicians, we are worried about this unforeseen situation that is happening, and it's the effect of time and technology and change in the community and society.
I think it would be hard to maybe sometimes differentiate between normal adolescent stresses and something that's more serious. I don't know.
Well, and that's why I brought up, children learning coping skills, because, I was on various antidepressants, and they're definitely, I think they can be very helpful, and yet I got off all antidepressants, all medication altogether, and it was, very strong commitment. And I went through very intensive therapy, which taught me things like to make sure that I was, meditating on a regular basis, being mindful, radically accepting what was going on in my life, things that I could direct my mind and direct my behavior. And yet, if it was something that was in the education system where kids learn certain things like that, so like you get to a stressful situation, reach out for help, have those connections.
Identify it and help.
Yeah, and even train parents, like how do you build that connection so that, because most parents will expect that at some point their teen will probably get distant and start to retreat. So how do you maintain that connection, and how do you reach out whenever you start to see signs, well, maybe my teen is in trouble? And I don't know of anybody that's really doing that. And yes, it would, it would potentially be costly, and yet, I think it would save a lot of lives, and just the quality of life would be so much higher.
Are people talking about this? Do we hear this, the idea of kind of the presidential fitness standard? I'm thinking of physical fitness. Is there a push? Is this popular to talk about educating kids emotionally?
I would say so, big time. And if I can just speak for MIMH, we take this so very seriously. One of our flagship programs is called Mental Health First Aid. And this is a training that teaches the lay person how to recognize signs and symptoms of mental illness. It is clear doctors' offices are overloaded with patients, but the program, in a sense, is really designed to recognize a sign and or symptom. If a person is dealing with something, they're a lot more likely to tell a friend friend than they are even their physician. So if you're that friend and you've had this training, then you can say, you know what, this sounds like this, perhaps you need to get this help. So I think if we can encourage, and this is just one of the many trainings that are available, but if this is something that the community would like more of, MIMH can definitely be a part of making that happen, because it's just that important. And this also continues the conversation, you know, when you're having trainings such as this.
Yeah, that's amazing. I mean, that's something that I think could make such a big impact if it was more widespread. And,
Sure.
You know.
In support of what you just mentioned, I have to also mention that, you know, on one way, social media is a double-edged sword, so you see that there is an impact. But on the other hand, we see a lot of kids confide in their friends about having suicidal thoughts, and these are the friends on social media that initiate the call to 911 and police.
So there's an
or
upside.
contact. Yes, there's an upside to this. And I really think that it comes back to the fact that you mentioned that there is more emotional education in our adolescent population now compared to probably the last 2 generations.
I think part of the education is reducing the stigma so that when the stigma is decreased, then people are more prone to be able to reveal something that they would feel otherwise ashamed to admit. So if they feel comfortable with friends who do not embrace the stigma surrounding mental illness, then they would feel more open to confide in friends about their condition. So
If you have that self-awareness, that education, it doesn't matter if you're too afraid to talk about it or if you're too ashamed to talk about it.
right.
Can your son, do you and your son have that? You mentioned that you share, that you're both living with bipolar disorder. Is he able to talk to you, or are you able to talk to him about this?
You'd have to see the movie, but
That's great.
he's in it. He's in it. He kind of tells his story in front of whole St. Louis area on Fox News, and you know that he has bipolar disorder. And I think for him it felt very freeing that he could get it out there, and nobody had anything on him anymore because he'd put it out there. I think the biggest thing that I see working with kids is that a lot of parents have no idea if their child is suffering from mental illness or just being disrespectful. And I'm talking like the 8 to 12-year-olds. And in many cases, if they're not responding to normal discipline, then, and never responding to normal discipline, then that's often a sign for us that they may need to see, you know, a psychiatrist or see somebody else.
All right, we'll pause it right there. We'll continue the conversation online. Stay tuned.9net.org. Also hashtag Stay Tuned STL. Thanks for watching us tonight on the air. Until next time, stay tuned. Did I cut you off? I'm sorry. Was there something I just cut you off about?
I don't remember.
Okay, good. What else are you all talking about that you want people to know about that maybe isn't in the part of the mainstream conversation?
Go ahead, please. Medical management with psychiatric drugs can be very tricky. I think that with each individualized condition, it's hard to find the right combination of medications. And it could take very many years to find a good combination, especially with new advances in medication. And also the different seasons in life that come upon you could instill a time of lack of sleep or increased anxiety or depression. So recovery is not always linear. Medication management can be very tricky because sometimes you can experience side effects that are unideal.
A step backwards?
A step backwards. Sometimes you want to get a step forward, you get a step backwards, and it can be very frustrating. But
yeah, I've had side effects that have been worse than what they were going to cure.
Yeah.
And this kind of goes back to what you were talking about, just in the sense of keep trying if something's not working. I don't know that you were speaking directly like this, but
Yeah, and as well, some symptoms and signs, if you go to just your regular physician and you're not thinking about perhaps a mental health challenge, it may sound like a physical ailment, you know. So it is very important that when you go to your physician, you talk about things that are happening. If you are not, you know, losing sleep, maybe perhaps you may have lost a job, there was a recent death in your family or a divorce. Those can be triggers that you should share with a physician because, again, you may be having symptoms, and the doctors, of course, can speak more to that, but that really lend to a mental health challenge versus a physical challenge.
I think Mark pointed out that there's a real shortage of trained mental health professionals in not just our state, in many areas of the country. So in many a time, it's really the primary care setting where people first seek help and identify a problem. So I think that's an important recognition, and many primary care practices now are instituting every year a depression screen and are willing to start people on treatments, and if that doesn't work, then refer them on to specialized care. So that is the place, I think, that a lot of things get started.
I feel fortunate. I just had my physical not that long ago. I felt like more of the questions were about my mental state than they were my physical state, honestly.
Well, I believe that they're concomitant.
Yeah.
Physical, it's holistic health. The sleep, the exercise, the environment that you're in, the positive energy you get from your support system and friends and family, and everything else. It all adds up to the mental. They're both all interlinked, basically.
Well, and you were saying you're going to have a harder time curing or fixing a physical problem if the other isn't in
Absolutely.
line.
The impact of mental health on management of the medical conditions are very well known. The studies have been done. A local study that was done at SSM hospital system just showed that depression, bipolar disorder, and ADHD's impact on management of the two most expensive medical conditions, actually three, including cancer. Congestive heart failure, diabetes, and cancer is so significant that it has become mandatory for doctors in our system that you have to screen for all these psychiatric conditions at the same time that you're treating them for underlying or overlaying medical condition, because they're so much intertwined. The management of congestive heart failure, the management of diabetes, the outcome, the quality of life of your patients are so much intertwined with if they have anxiety, insomnia, mild depression, thoughts of suicide, that you must treat all those people. All of the cardiac patients who are receiving major cardiac surgeries are known, 70% of them will develop panic disorder, depression in the phase of recovery. And it's been shown that the outcome is very poor if the depression is not predicted during that phase and during that phase of rehabilitation. And patients may actually die if their depression is not treated. Wow. I wanted to bring another point also.
Yes, please.
And that is the role of our educational system with mental health system that we have. I truly believe, and I'm sure that probably you would all support that, that educational system can be the gatekeeper for detecting mental illness and making sure that resources become available to our children and adolescent population.
Can the teacher, the educator, see something in a way a parent might not be able to?
Absolutely, because they're spending 6 to 8 hours every day, they're there. And as a parent, you may see them a couple of hours and you may not, this is your child that you see in and out every day. You may not notice that aberrant behavior or the relationship that they have with the peers or the issue of trauma. One particular focus in our mental health in the United States has to be how to deal with the trauma and repeated trauma in one's life that may deal to serious outcome with mental illness. That is something that we're not investigating enough, we're not spending enough funding on it or enough research on it. But we have to deal with it in adult life. And I'm not talking about necessarily sexual trauma, I'm talking about financial trauma, poverty, physical traumas, emotional trauma, significantly. And that is an ongoing problem and challenge that we have as clinicians when you get the kids in the hospital.
Very good point, Doctor. Just thinking about our region in terms of trauma, Ferguson, right? Seeing that on the television multiple times a night.
Missing school because of it,
missing school.
Parents not going to work.
I've talked to multiple teachers, particularly in the Ferguson-Florissant School District, that talk about the heightened number of fights that were happening at school, just the disconnect from themselves and the students because of all that was happening. So I think
the very issue itself that was being talked about.
Yeah. We as a city have to address the trauma that we experience from all of this, and what are we doing with that, right? We can't just ignore it. It's not something you can put a Band-Aid on and just hope it goes away. So I think considering what we've all gone through, it's almost been a year now, coming up to August again, what have we done with this?
Has anyone done anything with this on that level that anyone at this table knows about?
On the mental health?
Yeah.
For Ferguson-Florissant, in those areas? I know Children's Service Fund has been very, very supportive of trying to get more agencies working in those schools. But in a lot of those schools, they also have an issue of they're trying to get accreditation. And this was their third year to get that accreditation. So for them to take kids out of the classroom for even therapy, even though it's super important, it is probably in the long run going to do them more benefit than being in a classroom. They struggle with that because, again, because of the testing.